All right, let's break down a vital clinical concept, measuring how well the heart is really working. So, we all know the heart is a pump, but how do you actually put a number on that? And this is the magic number we're after. It's a critical look at a patient's overall health. Clinically, you'll almost always start with the least invasive methods, so let's begin there. You'll see this all the time, the echocardiogram, or echo. It's basically an ultrasound for the heart. The math here is pretty simple. It just multiplies the blood per beat by the beats per minute. But, sometimes you need a more precise number, and that means getting a little more invasive. And that brings us to thermodilution. We inject a cool liquid and see what happens downstream. How fast that temperature changes gives us a really accurate calculation of the blood flow. So you see the trade-off, right? Less invasive with ECLO versus more direct with thermodilution. But what's the core scientific principle behind all this? It's actually some classic physiology. And that would be Fick's principle. It's a brilliant idea that uses oxygen as a natural marker.
It works by comparing oxygen levels in the blood before and after it goes through the lungs.
You just measure the O2 going in and the O2 coming out. That difference tells you everything. Okay, quick heads up. Here's a common point of confusion when you're first learning this stuff. You're going to hear a lot about something called a VQ scan, which also looks at the lungs. And this is absolutely critical, it is not used to measure cardiac output. Don't mix them up.
A V/Q scan is all about spotting things like a blood clot, not calculating the heart's output.
All right, let's wrap this up and summarize the main tools you'll be using in the clinic. So you've got echo, thermodilution, and the Fick principle. 3 totally different but powerful approaches. Which, of course, leaves us wondering, what amazing new non-invasive tools are just around the corner?